So Harvey, because you have in fact written a book about ChatGPT, so why not? I'll start with you. So discuss a bit about the impact of ChatGPT and generative AI in healthcare. What you are seeing really.
First of all, healthcare in general is a very conservative vertical as opposed to other AI applications. It's a lot easier to do. Obviously, in healthcare, we have to worry in the United States about HIPAA, but the big picture is privacy laws around the world. And so, how is it being used today? It's quite interesting. I divided it in two sets, and we'll go into it later with everyone. But basically, we have applications that patients use, and we have applications that doctors use. As far as doctors, believe it or not, every 30 days, medical knowledge doubles. That means that I'm responsible to know so much more. And obviously, that's why a lot of doctors specialize in a certain part of medicine. And so using ChatGPT, even though, yes, there's a lot of negatives and hallucinations, and it wasn't meant for that, doctors are still using it to help them get educated on things that they are not familiar with. Obviously, they're looking at the references from ChatGPT and verifying those references. On the patient side, I feel like they're getting better discharge instructions using ChatGPT, having a doctor vet that information from ChatGPT. Given that point, I'm also aware that patients are now using ChatGPT as their new Dr. Google. And we'll go into why that may not be a great idea. So I'll leave it at that and we'll keep going.
Great. So, Harvey, just to extend on that thought, any particular examples where you see a substantial use of ChatGPT in healthcare?
Yeah, I think the low hanging fruit right now, because of the way our laws are set up and because of the hallucination, I think the best low hanging fruit is to allow doctors to vet the information from ChatGPT. For example, if I'm a diabetic doctor focused on diabetes, to increase my discharge instructions in diabetes awareness, use that information for websites. Give you a quick example. I love this example from England. Basically, they took a 5-year-old that's suffering from asthma for the first time. Instead of giving them the documents of discharge of asthma, what they did is they converted it using the power of ChatGPT to speak as if you were talking to a 5-year-old. Then they took that plus Dolly, which basically helps them create pictures, and they made a coloring book, and they put it all together and gave that to the patient. I think that is the new way of delivering healthcare, very specific to that patient for that age group, how they understand. The other barrier is that doctors talk a lot of medical jargon. And so to be able to use a GPT equivalent to bring it down and speak to a person that their language level. So if you're talking to a 5-year-old, to be able to convert that to a 5-year-old. So I think those are the newer applications that can be done pretty much quickly. And it doesn't need much more than having a doctor make sure that that information is accurate.
Right. Great. And I think that this can really have a lot of impact because, it's one of the problems I always face, that how do you, let's say, explain something to different kinds of people. So old person would understand a certain thing a certain way, while a child could understand a certain thing a certain way. So that I think is golden, really, impacting real lives that way.